Hi, I'm Dr. Jessica Sapoff, and you're listening to DentalMD on KKNW Alternative Talk 1150. I'm here every Wednesday from 9 to 10 in the Seattle area. And today is part 2 of Dental Controversies. Last week I talked about some of the biggies: mercury, fluoride, root canals, and Nico lesions, which are sometimes referred to as cavitations. And that was, when I left off, I wanted to get on and talk about nickel and BPA, which is bisphenol A. And those are the next materials that I want to discuss. I want to go back and say one thing about mercury, and that is that I'm not going to argue about whether mercury is toxic. I think the time has come to an end for discussing or arguing about the science of mercury. Mercury is mercury. There are different forms of mercury, but all of them are toxic. Every toxicologist in the world understands that the safest level of mercury is 0. It's been removed from all areas of medicine and veterinary practice, and the only place where mercury is still legal to use is in dentistry. And there are a lot of people working to change that. And all we really need to focus on now regarding mercury is making sure that dentists get trained to take precautions and to set up safety protocols so that when they have to remove it or a patient chooses to have it removed and upgraded to better materials, that nobody gets exposed to that mercury while it's being drilled out and removed from the teeth. Sometimes it has to be removed because there's decay or broken tooth or the filling is cracked or whatever reason. But other times it's a cosmetic change because the mercury amalgams are not lovely looking. They are kind of a gunmetal gray, and they can be shiny, but that's about the best I could say about how they look. And the other reason would be because somebody has decided that they no longer want to be exposed to mercury from their fillings, even though it's a small amount. Like I said, I'm not going to argue about whether or not mercury is toxic. It's toxic, very toxic, even in very tiny quantities, and that's just a known fact. So I think we can put that one to the side and just move on and talk about how it can be dealt with safely now that we need to deal with eradicating it out of the rest of medical practice, and that means dentistry. Okay, so that will probably wrap up mercury for now, and I'll get back to it in future shows because I'll be explaining what those protocols should be, but I'm not going to get into those details today. Those safety protocols, it really needs to be treated like a hazardous material remediation. So let's move on and talk about nickel and plastics that are used in dental materials. So nickel and plastics and ceramics. Let's start with nickel. Nickel, any material that comes with a warning label, whenever there's a material that arrives in the office that has any nickel in it, it has a warning label on it. And the warning label says, this product contains nickel, which is known in the state of California to cause cancer. Now, why would it specify California? Because California has very strong or stronger than other states consumer protection laws. And so they get to have these warnings. They also have a law which the people voted for in a referendum that the dentists there have to inform them of what is in the filling materials, what is in the materials that are going to be permanently placed in the patient's mouth. There are only 4 states in this country where it's actually law that dentists must give the patient a material fact sheet. So as far as nickel is concerned, anything that comes with a warning like that, when you go to a drugstore and you have a prescription and you want to go and fill that prescription, the pharmacist by law must pass along the warnings from the manufacturer to you. That's why you're given this long thing to read that says all the contraindications and all the possible side effects. By law, they have to give that to you. And I think that it should be standard practice in any time you're being given any kind of thing that's going to go into your body, that you be provided with all of the information from the manufacturer of that product. And so just as a standard practice, I always make sure my patients know what it is they are getting. And I just think that should be a standard. I don't understand why everybody doesn't do that. As far as nickel is concerned, anything that comes with a warning like that, that patients deserve to know that that's what nickel is. And nickel is kind of a cheap metal. It's used in dentistry, in crowns and bridges that have porcelain baked on top, and not even always then. It's considered base metal. It's part of an alloy, and there might be some other metals mixed in. And the reason it's considered biocompatible by the American Dental Association and the dental industry is because it doesn't kill your tooth. So if your nerve in your tooth stays alive after this stuff's been put on your tooth, then everybody figured that that's good. That must be okay then. But biocompatibility extends to the effects on your entire body, your entire system, and that's why natural and holistic dentists always consider every possible aspect of toxicity, not just the toxicity to the tooth itself or to the nerve in the tooth. Nickel is also in many orthodontic materials. All the wires, even if it says no nickel or low nickel on the package for the wire, it almost invariably, back when I used to use wires in my orthodontic treatment, I was told that when I bought a wire or an orthodontic thing that said no nickel, that it still had a very little bit of nickel in it. Nickel's got a couple of problems. Besides the being carcinogenic, it's also electrically active, and so when you put any metal, any two dissimilar metals into an electrolyte solution, which saliva, by the way, is a great electrolyte solution, and you put two dissimilar metals into an electrolyte solution, any chemist or chemistry student will tell you that you're going to be creating a battery. You're going to have measurable current. Now, that current is maybe low enough that you can't feel it. Maybe you don't get zings or, electrical discharges happening in your mouth, but that doesn't mean it's okay to have this electrical current that is many magnitudes higher than what our nervous system operates on, and it is only a few inches from what I call grand central, of course, your brain. But we don't really have a lot of research that's specific on what this electrical current causes, if it causes anything. And it just seems to me that if we're going to be using materials in the mouth, that they should be as similar as possible to what nature gave you. And nature didn't give you something that created a big electrical current running through your mouth. So as I replace old restorations, I always move toward less conductive materials. And I don't think there's anything that's completely 100% non-conductive, but I think ceramic is about the most inert when it comes to electricity. So that was some things about nickel. There's one more thing about nickel I want to mention, and that is that it's highly allergenic. You probably know people who are allergic to nickel. They are the ones that say, I can't wear any cheap jewelry. I can only wear gold, or I can only wear silver. And it turns out that something like 90% of women have some level of allergy to nickel, and maybe 40% of men. That was the statistic that I recall. And so on my medical history form, I have a question there that says, are you allergic to any metals, any jewelry, reactions to jewelry, that kind of thing? Because really any metal, if it's being placed in your mouth, it should be jewelry quality. It's going right up against your gums. And if it isn't jewelry quality, or you have an allergy to it, you really can get a little local dermatitis from that material, and that will look like red gums. Most of the time, dentists or hygienists will tell people who have a red gum line around a crown, oh, you're not brushing that one well enough, as if you could brush that whole side and not brush that one in the middle between the other two that are being brushed well. I know that sounds like, logic, but anyway, I really think that a lot of these gum reactions and gingivitis around specific teeth, that it could be a reaction to the materials, especially something as allergenic as nickel. All right, well, nickel also shows up in those stainless steel crowns that many pediatric dentists place on children's teeth, the molars, when they have decay. And I recommend avoiding those. Sometimes in this profession, it is said that there aren't any other options, but there are always other options. There is always another way to do things. Just have to be creative and come up with something that works. So let's move on from nickel and talk about resins, because most of the filling materials that we replace the metal restorations with are plastics. And we all know that there are some plastics that we use in our kitchens that say, do not microwave in this plastic, or, this is a food grade plastic and this one isn't. Don't store food in this. Okay to store food in that one. Then there was that whole thing with the drinking water bottles with BPA, and then all of a sudden everybody became aware of what BPA is and that it's in their water bottle plastic and it's getting into their water. And people became very aware of that, and it does go into your water. And it is in some of the resins, but not all of them. Now we're coming up on a break, and I am currently talking about resins, and we're going to continue that after the break. I'm Dr. Sapoff, and you're listening to DentalMD on KKNW Alternative Talk 1150.
Having trouble picking up the Alternative Talk 1150 signal? Well, whether you live in Portugal or Puyallup, Tasmania or Tacoma, India or Issaquah, you can get Alternative Talk 1150 programming streamed live on your computer via our website, 1150kknw.com. It's true. Just visit 1150kknw.com and click on the Listen Live button. Make sure you have an audio player installed that will play streaming MP3 audio such as Winamp, iTunes, or current versions of Real Player or Windows Player. Visit our website for more details. Remember, that's 1150kknw.com.
I'm in almost every school bus and classroom. I go to school with your children. We say the Pledge of Allegiance together. You've seen me around the neighborhood, and you've told me I'm a pretty good kid. Well, I'm one out of every 4 children in America, and I'm struggling with hunger. This problem is closer than you think. My teacher tells me we could grow up and be whatever we want. I want to grow up and be someone who doesn't go to bed hungry. There's enough food in this country to feed everyone. Please visit feedingamerica.org today and find your local food bank for ways to help. Every dollar you donate helps provide 7 meals for kids like me, quietly struggling with hunger. Together, we're Feeding America. Brought to you by Feeding America and the Ad Council.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the DentalMD radio show, Wednesdays at 9 a.m. on Alternative Talk 1150 a.m.
The new mainstream of talk radio, Alternative Talk 1150 a.m.
Okay, I'm Dr. Jessica Sapoff, and you're listening to DentalMD on KKNW Alternative Talk 1150. And This is part 2 of Dental Controversies. I have covered nickel, and I'm now talking about plastics in dentistry. The plastics are known as resins or composites, and there's another class of materials called glass ionomers, and sometimes those are combined with resin, and then they're called a resinomer, I don't know, whatever. There's different names, comprimers, and I don't know, different machinations of English to describe those. And so what we mostly are concerned about with those is the resin material itself. Glass ionomer has other issues, and I'll get to that in a few minutes. The resins some of them have BPA, and that's bisphenol A. That is an estrogen mimicker, and it's an estrogenic molecule. That's why everybody is concerned about it. You don't really want to be getting a lot of extra bisphenol A into your system. It can create imbalances, hormone problems, various things. And I'm not a physician, so I'm not going to go into that, but you can look it up or discuss it with your naturopathic physician as to what kinds of symptoms and problems those chemicals, that class of chemicals, can cause. Now, as far as resins are concerned, they're also called composites or composite resins. And just as I was discussing with the different plastics available for use in the kitchen and other places, in water bottles, etc., there are a lot of different plastics available in dentistry, and some of them don't have BPA in them. Plastics are also not just filling materials, but they're also used in the clear orthodontic appliances. They're used in TMJ appliances, night guards, retainers from ortho. Just there are so many, and also there are plastics used in partial dentures when you have a removable tooth instead of a bridge or an implant. You have a denture or a partial denture. Those are mostly made of plastic, and by the way, many partial dentures also have metals, which many times contain nickel, but we've already discussed nickel. So let's discuss the plastics. Now, there are a couple of brands out there that dentists can buy that don't have BPA, and there are brands of the meltable plastics that we use for retainers and things like that don't have BPA. It is important to avoid that. Some of those materials are more costly. There's a reason why it costs more to have your dentistry done in a holistic office. There's been a lot more research. Many of the materials are more expensive. The availability of these materials, the companies that make them are a little bit smaller. They don't tend to be the giant high-volume companies. There are just many reasons why costs are higher when you're kind of focusing on these higher quality and specific kinds of materials. There are good reasons to use resins. They bond to the teeth. They literally glue the tooth together from inside the tooth, from inside that cavity in the inner walls, because you're bonding. That's what everybody used to talk about when they said bonding. And now we don't just say, are you having your teeth bonded? I mean, everything is bonded these days. Bondodontist, that's what we all are if we're using resin. And if your tooth has cracks in it, which they almost invariably do after they've had the mercury amalgams, because the amalgams expand and contract at a different rate than tooth enamel, and so they tend to crack your enamel. But those resins will really strengthen the tooth from within because it bonds together from the inside. If they're not done carefully, it can actually as the resin shrinks slightly during curing, it can actually pull in on the cusps and cause post-operative sensitivity. So it's actually kind of more technique sensitive than some of the other materials. Which means the dentist has to really know how to use these and how to do the bonding and how to cure it, which is the little light curing unit that we shine over it that polymerizes the material. It's actually a light polymerizable material. That's not a heater. It's not a hairdryer. It looks and sounds like one sometimes. And those materials are light polymerizable. It is important to fully cure them so that the off-gassing is minimized. Whatever off-gassing, all plastics off-gas. The more cured they are, the less they off-gas. That is one of the reasons why people sometimes choose ceramic. Ceramic does not off-gas. It's extremely inert. So let's move on from the plastics and talk about ceramic. There are many, many good ceramics available now. To place ceramic in a tooth, the tooth has to be prepared so that an impression can be taken, and then that's sent to a lab, and the lab will make a little ceramic piece that fits in like an inlay or an onlay or a crown over the tooth and in the tooth to replace the missing parts of that tooth. Now, if your little amalgam filling that's been removed was pretty small, I'm going to tell you that if you switch to ceramic, that tooth is going to have to be drilled quite a bit more because it's got to be made large enough. That hole, that missing part has to be made large enough so that the lab can make a ceramic piece that can fit in there. If it's too tiny, they really cannot do that. It becomes very difficult. And so most of the time, a dentist will do much more drilling and make a nice substantial area so that the ceramic can be big enough to handle and not drop and lose, because ceramic is, once you drop that, you probably never find it again. It looks like a little piece of sand on the floor. So these ceramic pieces will be cemented or bonded into place. If you have a small filling that's being replaced, it is probably better to go ahead with a biocompatible resin material. Unless you're allergic to every kind of plastic, it's a better idea to drill less. If you're choosing between the perfect ceramic versus having your tooth drilled less, I think I would choose less drilling, because drilling on the teeth is always traumatic to the nerve. Most of the time the nerve does okay and doesn't die, but just less drilling is better, because if there are cracks in that tooth and the drilling out of the material always creates some vibration, and those cracks can propagate. Just like when you have a crack in your windshield of your car and you go over a pothole, all of a sudden that crack will just propagate right across your window and become a larger line or defect in your glass. And enamel is kind of glass-like. It has a lot of properties that are like that. Now, for ceramic is very inert, but some people will say, but wait, it's aluminum. There's aluminum in ceramic. Well, yes and no. That's one of those areas where a little knowledge can be a dangerous thing. Yes, the material is like sand. It is aluminum oxide. Now, aluminum oxide, it's actually the oxide of aluminum. It's not aluminum, the metal. Aluminum is very bad. You don't want that in your body anywhere. It's highly toxic. But the oxide of aluminum, it has been heated to such a high degree that it is no longer aluminum metal. It's now the oxide of aluminum. And it can't donate an electron. Chemically, it does not act as a metal. It doesn't act electrically. It doesn't interact the way metals interact with other materials. And so from the chemists' and physicists' point of view, the oxide of aluminum is not aluminum. It's not the metal. It's the oxide of aluminum. It's not aluminum metal. So hopefully that puts that problem to rest. There will still be people who say, nope, it's aluminum. I don't want ceramic. But, if you look at the whole science related to that, you see a whole different story emerge about ceramic. There are many, many kinds of ceramic out there. Some of them have little bits of lucite and other things in them. Some of them are zirconia, which is an extremely tough ceramic. I like to use zirconia in the back teeth, the back molars. I have seen it break occasionally, but most of the time it's very, very tough. You could probably run over it with a car and it wouldn't break. And it's really a good substructure for bridges. And then they bake a prettier ceramic over the top of it, because zirconia is extremely dense material and it's not particularly aesthetic. It doesn't refract light the way enamel does. It tends to look a bit opaque. So it's not as beautiful, and it shouldn't be used right on the fronts of the front teeth. But for a back molar, it's perfectly fine. And, of course, porcelain a prettier type of porcelain can be baked on the top to look exactly like tooth enamel. All right, I think that about covers it on ceramic and whether you might choose a filling made out of plastic versus ceramic. A little bit about glass ionomers. Glass ionomer is a material that doesn't have to be bonded the same way to the tooth structure. It attaches to the tooth structure by a process called chelation, and it actually works very well on the deeper layers of the tooth, which are more porous and a little bit moister, where bonding resins doesn't work quite as well. The bonding for resins works well on the outer, harder, less porous enamel and outer dentin, but glass ionomers are excellent on the inner parts of the tooth, and sometimes a filling that's going to be resin you can put a layer of glass ionomer down first into that floor of the cavity, and that helps prevent a lot of post-op sensitivity. Glass ionomers, they do have glass in them. Glass seems to naturally contain some sort of fluoride. It's probably the same fluoride that is just present in the Earth's crust. It's not a chemical additive. It does come out of the glass ionomer, but it's if you were going to go out to the mountains and drink mountain water from a stream, you would get trace amounts of fluoride from that because fluoride exists in the Earth's crust, just like you will get trace amounts of, probably 90 different minerals, trace elements. So for some reason, the fluoride that is just naturally occurring in these glass ionomers, it doesn't seem to test out as being a problem, even for very chemically sensitive people who go and get testing to see which materials are compatible for them. I have not found glass ionomers to be a problem for the majority. Now, a lot of dental materials, the manufacturers will add fluoride to these glass ionomers because they absorb it and then they give it off. Once the material is placed in the teeth, it actually this fluoride will emanate out of the filling and into your mouth and into the surrounding tooth structure. And, of course, dentists who think fluoride is a great thing, they think that adding fluoride to these materials is also a great thing. But that added fluoride is the fluoride that we've been talking about as perhaps being something you would choose not to expose yourself to. And so the glass ionomers that I use, the ones I buy, never have any added fluoride in them. So that is a great material to use in children's teeth because it is easily placed and you don't have to go through a messy and uncomfortable bonding experience, which just for kids, it can be uncomfortable because everything has to be isolated well. Well, you're listening to DentalMD. This is Dr. Jessica Sapoff. We're coming up on a break, and we'll be right back.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the DentalMD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Delaterre here, Flora Delaterre, plant detective. Drawn by the mystery of medicinal plants and their alarming disappearance, I decided to investigate. I'm deep in shady woods in Ohio, among thigh-high plants with purplish stems and blue-green paw-shaped leaves. It's blue cohosh, no relation to black cohosh. It's also called papoose root, blueberry root, blue ginseng. Like ginseng, it's secretive, preferring secluded places like this. Its berries resemble blueberries, but grow in clusters. Papoose root hints at the medicine in its roots. Women used blue cohosh to start childbirth. It stimulates oxytocin production, strengthening contractions, easing pain. But there's a chance blue cohosh could stress or even damage a baby genetically. It's no longer recommended for childbirth. If you're not pregnant, blue cohosh is a great, safe uterine tonic. But conservation-wise, it isn't that abundant, so it's better to tiptoe away and use a more common plant with similar properties. The Plant Detective is a project of Montana Public Radio, Thai Sophia Institute, Bastyr University, and Frontier Co-op, bulk supplier of organic herbs. Consult with a health professional before taking medicine or herbal remedies. Folks, medicinal plants are everywhere, and you gotta treat them right, because someday they might be treating you.
Radio for your body, mind, and spirit. Alternative Talk, 1150.
I'm Dr. Jessica Sapoff. You're listening to DentalMD on KKNW Alternative Talk 1150. And this is part 2 of Dental Controversies. I was just wrapping up before the break talking about glass ionomers. And let me just clarify, putting glass ionomers in is not uncomfortable. That really wasn't a great choice of words. But when you're 3 years old and you can't sit still for very long, it is what I meant to say was it is more comfortable if you can get something in there a little quicker for them because they can be very wiggly and they really don't like to sit still for very long. And if you're doing a bonding process, there's one part of it that can be a little bit smelly or not taste very good if they get a little bit on their tongue. And for a 3-year-old, if they get a little something on their tongue that doesn't taste good, that appointment might be over with. I mean, right then and there, because they start to struggle with you just because something didn't smell good or taste good. We do not have that problem with most of the adults. And so for children, when I say uncomfortable, I mean they might have to sit still or not or tolerate something that doesn't smell or taste good. So yes, I did not mean any kind of pain when I said that. So, okay, let's move on and talk about titanium as a material. Titanium is considered to be a very biocompatible material in medicine. It's used a lot in, hip, knee, joint replacement surgeries and things like that because they've got to use something. And so they tend to use a surgical stainless steel or titanium in these applications. But that doesn't mean that every single person is okay with titanium. It is a material. Any material, you're probably going to find somebody somewhere that's either allergic to it or can't tolerate it, or it is metal, so it's going to have some electrical interactions with something, especially if you're putting it in the mouth and then you put some other kind of metal right on top of it. Titanium is used as an implant material, and so most of the time there's another piece that gets screwed into that, and on top of that goes your crown or your bridge. And each one of those components is made with a completely another alloy of metal in most offices. Whenever I have somebody who has an implant that's going to be restored, at my office, I use ceramic attachments. So I don't add another metal or screw another metal into that. I screw a piece of zirconia material in and then cement a zirconia crown on top of that. The only dissimilar metal, and there's no way to avoid it, is that the screw itself is made out of something. And that's the only kind that's available. It's probably stainless steel, but that is going to go right down inside the implant to secure the abutment and then the crown. So, you really, if you're doing an implant and you're using titanium, you're not going to be getting away from metals in that case. But like I said, titanium is considered to be very inert. Most dentists believe that there are no allergies to titanium. I'm not so sure that's true. I have heard people say that they can't tolerate titanium, but I didn't see the medical evidence of that either. So let's move on and talk about crowns versus onlays versus fillings for just a minute. Crowns are, I don't know if you've ever had a crown put in your mouth or on one of your teeth, but in order to place a crown, and they're sometimes called caps, and the reason they're called caps is because they completely cap over the tooth. No part of your tooth shows unless you have a little root exposure down below it. But it basically covers your entire tooth, which means that your tooth has to be reduced down to a little stump shape. And that is quite a bit of drilling. And sometimes the nerve inside gets pretty irritated with that much drilling. Not always. Many times the teeth can be reduced down and the nerve does okay most of the time. But the reason to do a crown is usually because that's the way we're taught to do it. It's pretty quick to do a prep that way. It covers the whole thing. Dentists believe that perhaps you won't get any new decay because they're putting the margins of that crown at or below the gum line. That's not true, though. You can still get decay below the gum at the edge of the crown. Any place you've got some tooth structure, you could get a cavity. So I try to avoid cutting crowns. I prefer to make inlays and onlays. And an onlay is very similar to a crown, except that basically I'm going to cover and protect all the weak biting areas of that tooth, cover and protect the biting surface, and the margins, the side walls of that onlay come down partway to brace the tooth so that when you chew on it, you can't flex any weak parts of the tooth and break away any pieces. And those work very well. It just takes a little bit of designing, a little bit of engineering, and consideration of which kind of ceramic or what kind of material you're going to be replacing that missing tooth part with. But preserving a lot of natural tooth structure is very important. You can't grow that back, and once it's gone, it's gone. And less drilling means your nerve is more likely to survive. And we talked about root canals last time, which are one of the options when the nerve dies. And so if you are interested, go back and get the archive of show number 1, not show 1, but the first part of Controversies, which was last week, where I discussed root canals. Okay, fillings are great if you can do them because there's less drilling, but you don't want to have a huge filling with weak tooth structure around it because those parts of the tooth can break away. Let's switch from restorations now, and let's start talking about TMJ. TMJ is a great controversial area in dentistry. There's a lot of disagreement among the professionals when it comes to TMJ, and that stands for temporomandibular joint. Your jaw, your lower jaw, which hinges open and closed and forward and back, it has a structure where as you open and close your mouth, there's a little cushion called the disc, which slides and moves along and protects your condyle of your mandible from contacting the temporal bone. A lot of times people will hear crunchiness or popping and clicking, and that is because there's a structural discrepancy. There's a malalignment inside the joint where the disc is either not able to move freely for some reason, or maybe there was an injury, or it's been chronically out of position and now it's stuck where it is. And it can kind of slide around and pop back into position as you open. That's what sometimes happens. As you're opening your jaw will click or pop, and then all of a sudden you'll be able to open the rest of the way. And that, if it doesn't hurt and it's not uncomfortable and you can eat and chew and everything works okay, then it's not necessary to pursue treating that necessarily. I mean, it all depends on the entire situation and whether you have problems with your teeth and your bite. There are certain kinds of the way people's bites come together that can make the jaw joint worse or better, or make you more prone to having jaw joint malalignments. But in the profession, it's really not very many dentists understand TMJ or treat it, and we're not really taught very much about it in school. Sometimes we're told that it can only be corrected by surgery, and dentists will make night guards for you to wear, or just most of the time they just have you live with your TMJ, or they manage it with stress management, like have you see a psychologist or a counselor and give you antidepressants or muscle relaxants. I mean, there are just a lot of sort of medical model ways to deal with it rather than structurally. And the controversy comes when dentists want to correct this structurally, and the rest of the profession says, no, you're doing something unnecessary. You don't have to do all that. You can just give them pain meds and tranquilizers, and that'll solve it. It's really just because they're too stressed out or whatever. And they kind of make it into an imaginary problem instead of a real problem that it is, a structural discrepancy inside the joint. I think we're coming up on a break here. And if you are just joining us, this is DentalMD. I'm Dr. Jessica Sapoff. This is KKNW Alternative Talk 1150. And we're here in Seattle, Washington area, talking about alternatives in dentistry. Thank you.
Kids have the craziest ideas about food. Where do they get this stuff? Like eating Brussels sprouts helps you hit home runs. And eating carrots gives you X-ray vision. It's nuts. And I honestly have no idea where my daughter got this notion that broccoli is the official food of professional ballerinas. Kids, the only reason my 4-year-old loves cantaloupe is because he's convinced it comes from the moon.
Run, small step for man, lots of potassium for mankind.
And the other day when my oldest came up to me and said, Mom, will eating peas and carrots really help me pull off a fakey frontside ollie with a twist? I look him in the eye and say, it can't hurt, honey. It can't hurt.
Moms everywhere are finding creative ways to help their kids eat 5 servings of fruit and vegetables a day. Get ideas, get involved, get going at letsmove.gov. Brought to you by the USDA, HHS, and the Ad Council.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the DentalMD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
You want to be up to date on the latest news, but you don't want to spend all day hearing about the minutia or spin. Well, now you can get the facts fast from the most respected name in news, CNN, with our quick updates at the top of the hour featuring the information you want, news, traffic, and weather without all the blather you don't want. So stick with Alternative Talk 1150 a.m. for your favorite shows and the information you need without all the baggage you don't. Alternative Talk 1150 a.m. Now better than ever. Alternative Talk 1150 is on the interwebs. Dial us up at 1150kknw.com.
Oh, thank you very much. Okay, I'm Dr. Jessica Sapoff, and you're listening to DentalMD on KKNW, Alternative Talk 1150. Today is part 2 of Dental Controversies, and I have covered nickel and resins with BPA and titanium and ceramic, and I was just getting going on talking about TMJ, which is temporomandibular joint dysfunction, TMJD, and there is controversy about this because there are so many dentists that don't have any training in treating and managing TMD, temporomandibular dysfunction. And it can be pretty debilitating to have pain right there next to right in front of your ears, or to have pain every time you open or yawn. And it can be managed in a lot of different ways. One of the ways that it's managed is through stress management, because some dentists believe that it's caused by a lot of clenching and grinding, and that's what causes the pain, and it's muscle spasms, and so they give you muscle relaxants and tranquilizers and send you for counseling and stress management therapy and things like that. But that may be good and effective for some percent of the population. But for the people who have an actual physical discrepancy and malalignment in the joint, it's actually possible to align that so that it doesn't click and make noise and doesn't hurt, and the muscles stop spasming and the pain stops and the jaw can open and close smoothly. The biggest issue with correcting that malalignment in the joint is that now that your jaw can open and close freely and without pain and without noise, now your teeth no longer align the same way because your jaw is closing differently it's got a different trajectory. This trajectory works for your muscles and your alignment within the joint, but now the most likely place that your teeth will hit when your jaw is aligned correctly for many, many cases is you will find yourself hitting just the front teeth and that your back teeth will actually not quite meet. And if you want to meet your back teeth together, you will, in many cases, have to draw your jaw back and up to get your back teeth to meet. And lo and behold, the click reappears and the pain comes back. So what can we do about this? If we align the joint and align the jaw and get it hinging freely and the muscles comfortable, now with the teeth not quite meeting, what can we do about that? That's where some of the arguments began to take place in the field, because some dentists want to go ahead and either build up your teeth or move your teeth orthodontically, or maybe give you an appliance to wear that's like a night guard, except it's more like a day guard, or an overlay denture, an overdenture, which sits on top of your back teeth to give you that position for chewing. It actually gives your teeth a little bit of height and position for the chewing surface so that when you close together, your jaw joints remain aligned and comfortable. Now, this turned out to correct things in any of these ways, turned out to be really costly because it's a lot of dentistry. Let's say a dentist doesn't do orthodontic treatment and doesn't like to work with those dental appliances or not for very long, and they want to correct it by crowning all your back teeth. Well, yes, that will give you a corrected biting surface, which keeps your jaw in correct alignment and comfortable, but that's 15 or 16 crowns, especially if they're doing the top and the bottom, or maybe just 8 crowns if they're doing all of your lower posterior teeth. And a lot of dentists argued with that and said that, well, that's over-treatment, and the insurance industry said, well, we don't think that's a legitimate reason to do 8 crowns, so we're not going to pay for that. We like the idea of just medicating people and sending them for therapy better than having to pay for all these crowns to correct people's bites. And so correcting what's called vertical dimension of the bite became this sort of catchphrase for, over-treatment, lots of crowns. And actually, in some cases, people have old mercury amalgams and old crowns with metal or crowns that are failing and that are already present, and it actually makes sense to go ahead and replace those with new restorations that correct the biting surface, the position of the biting surface, so that the jaw can continue to hinge freely and comfortably. But in cases where there were no crowns or dental restorations that need to be replaced, and it's not a very large distance between the back teeth that's needed to be corrected, I like to use orthodontic treatment and just move those molars into the correct position. It's kind of a long process. You have to support the jaw and keep the jaw comfortable and stable while you're moving the teeth, and obviously moving teeth destabilizes everything. So there is a way to do this. It's complicated. You have to know orthodontics. You have to understand TMJ, and you have to be willing to manage patients who tend to be in chronic pain because of these problems. All of those aspects mean that you're not going to find very many dentists that are well trained in this or have been doing it for very long. You will even have trouble finding dentists that are willing to do it. Dentists would rather just say that they don't think TMJ is a problem, that they think it's an imaginary ailment, and that people should just use a night guard, not grind their teeth, go for stress management, and have tranquilizers and take Valium and pain meds and muscle relaxants. And so that's why there is controversy in the field. And I think it's unfortunate that more dentists are not trained in understanding the jaw joint and the temporomandibular joint. Now, related to this is people have heard of sleep apnea. Sleep apnea, where when you're sleeping, your jaw drops back and your tongue goes back against your throat and it occludes the airway. It turns out that correcting the bite and having the jaw be in that position where the joints function best, the jaw tends to be a little more forward of where it used to be, and that happens to also open the airway. And so it's actually, jaw position, tongue position, swallow, muscle patterns are all related to this whole system of the position of the mandible. And one of the other controversial things that sometimes is done to correct the bite is jaw surgery, where it sounds very kind of draconian and barbaric, but it's actually pretty commonly done, where they go in and they do a surgery where they break the jaw back in the corners and move the tooth-bearing portion forward instead of just letting the whole mandible come forward. And so they'll move that tooth-bearing portion forward and up so that it meets the upper teeth, and they just let you heal in that position and call your bite corrected at that point. And then, maybe it's done because your jaw was tending to be back and you didn't have a big enough chin, and so maybe it was cosmetic. But a lot of this stuff is related to airway issues, not that surgery causes it, but that the jaw being too far back in the first place can occlude the airway or promote occluding the airway. And a lot of these appliances that people wear at night actually hold your jaw forward a little bit to keep your airway open. It's actually possible to determine at a pretty young age, these young kids, 6, 7, 8, if their jaw is beginning to have a position that's a little bit too far back and up, you can see that in the teeth at that age. And if the orthodontics that's done at that age is aimed at correcting the vertical height of the bite, the midline jaw position, I believe you can actually prevent a lot of airway problems later in life and a lot of TMJ problems. But that's controversial too, because there are orthodontists who have proclaimed that treating the TMJ, or that orthodontic treatment, any orthodontic treatment cannot cause, cure, or treat the TMJ. But I find it hard to believe that moving the teeth and changing the jaw position won't affect the joint, because clearly it does. And so there's a lot of heated debate within the field on TMJ and ortho and early ortho and how to do it and when to start it and whether to extract teeth or whether to expand the arches. I think that may be a good topic for a future show. We are coming up on the end of my hour for DentalMD, and I will talk in the next show more about orthodontics, early orthodontics, different techniques for orthodontics, and the effect on the TMJ and the airway, and more about children's dentistry in that same hour. You have been listening to DentalMD. I'm Dr. Jessica Sapoff. This is KKNW Alternative Talk 1150, and I'll be back next Wednesday from 9 to 10 a.m. here in the Seattle area. Thank you, and talk to you next week.